today I'll be talking about high blood pressure. I just found that it's important to, educate my viewers about all these kind of things at my free time. In addition to all my writings and everything, I just feel that the first word actually is health, all right, which I have often, I wrote about. So high blood pressure is a silent killer. I know many people in Africa will say, God forbid, and all of that. I'm not sure if that is helping anyone. So high blood pressure saves, detection of that high blood pressure, right, saves lives and improve quality of life. We all know, even when we were growing up, that high blood pressure is a silent killer up to today. And it has no visible symptoms that it can give to you. But yet, it increases the risk of heart attack, stroke, and even kidney disease. A lot of people, based on my research, having a lot of kidney diseases these days in Africa and around the world, here in the US as well. So nearly 50% of adults in the US have high blood pressure. Okay, but only about 25% have it under control, even here in the US. So you're going to listen to this video.
It's important because there's an epidemic of high blood pressure going on, and there's a lot of misunderstanding about what high blood pressure is. And yet, if there's one thing that you want to really control is high blood pressure, because it can cause heart attacks, atherosclerosis, strokes, blindness, peripheral vascular disease, kidney failure. So high blood pressure is very important, and it's totally misunderstood. So as a cardiologist, I see patients with high blood pressure, but they already have end organ damage. So today I want to tell you what the incomplete workup of high blood pressure is. Traditionally, when patients come to see us for high blood pressure, we say that, 95% of them are primary essential hypertension. Well, over the years, I've realized there's nothing essential about high blood pressure. You don't have to have it. And the 5% have a secondary cause, such as kidney failure or some sort of a tumor in the body. But majority of them don't seem to have a cause for it. And therefore, the next thing is we take out the prescription pad and we give you blood pressure medications. And that's right, we do want to get the blood pressure down. And you do want to get on medications now, early, before you start developing end organ damage. But the incomplete examination, I want you to think about the things that I'm going to tell you next. Over the years, I've realized that many patients actually can reverse their high blood pressure, unlike what I was taught in medical school, that essential hypertension is just essential. So the number one thing I've realized is that metabolic syndrome causes high blood pressure. If you reverse metabolic syndrome, high blood pressure goes away. What is metabolic syndrome? Metabolic syndrome is a cluster of high blood pressure. You have a low HDL, a high triglyceride, you're overweight, your body mass index is over 25, and particularly most of the mass is around the belly. And if you look around, there are a lot of people with this condition. Look, right now, more than 50% of our population is overweight, frankly obese. It is a symptom of metabolic disease. Now, not all obese patients or overweight patients have metabolic syndrome. We know that. 80% of the patients who are overweight have metabolic syndrome. But being overweight is only a symptom of metabolic syndrome, because there are 20% of the patients who actually have metabolic syndrome, but they're actually not overweight. And we call them TOFIs, thin on the outside but fat on the inside. They have a metabolic condition in their body that is actually causing them to have high blood pressure, lipid abnormalities, fatty liver, high insulin levels. So this metabolic condition, this underlying metabolic syndrome, can cause obesity, because when you have high insulin levels, you're going to get obesity. So how is high blood pressure happening in patients with metabolic syndrome, whether they're obese or not? What's happening is that it's the insulin. Insulin really paralyzes the arteries and the arterioles, so they don't appropriately vasodilate. So when you have high insulin levels due to a condition called insulin resistance, which is part of metabolic syndrome and the problem with your metabolism, you get high blood pressure. I've been actually treating metabolic syndrome aggressively in my office here, and we reversed metabolic syndrome through a diet, exercise, and weight loss, and changing to non-processed, non-refined foods, nothing artificial. I'm finding that the metabolic condition gets better, blood pressure gets better, and the weight automatically comes down.
A certain time of the day maximizes its effectiveness on your body. 2 glasses of water after waking up helps activate your internal organs. 1 glass of water 30 minutes before a meal helps digestion. 1 glass of water before taking a bath can help lower your blood pressure, as well as 1 glass before you go to bed can help avoid stroke and heart attacks. Drinking water.
So now that you have listened to all of this, start with life changing. You need to change your lifestyle. That's very important because early detection and proper management can reduce the risk of heart disease by up to 50%. Those are the statistics I'm looking at. Because as an educator, I will not just be throwing out numbers if I don't have the research data to back them up. So that means early detection of high blood pressure and properly managing it can reduce the risk of heart attack or heart disease by up to 50%. And I think for me, that's a very big number to work with. So uncontrolled high blood pressure, if it's not controlled, is responsible for nearly 7.5 million deaths. 7.5 million deaths worldwide each year. That's a lot, because in Africa they attach that to so many things. People can just move like that. They will say it's this, it's that, or when somebody is sick, they don't actually know what is wrong. Rather than going to see the doctor, they'll be going from one pastor or the other. Pastors, they are human beings. You are putting too much into them. You're giving them so much accolade and so many things they don't even deserve, right? And they did not earn it, but you just bring it to them and then they'll take it in. And many people just move out of ignorance. So on today's episode, whether you are a man or you are that woman, it's important to take care of your health. This high blood pressure can be controlled even through just lifestyle. So drinking of water can help digestion. When you have digestion, of course, it can improve the blood flow and all of that, but it's not enough. You need to go and see a doctor. Going to see a pastor that is not a doctor and who has doesn't know of your health record and anything, that cannot help you. So on today's episode, I just want women to take a deep breath. You need to take care of your husbands, because for me, I just cannot imagine to see my husband with that big stomach. It's not happening. It's not going to happen, because with that big stomach comes with a lot of big thing there. So you just don't want to have that, right? You have to help the men to help themselves. You have to do more, because when you have obese, you listen to that doctor, what he analyzed, that actually increases the blood pressure rate. So the lesser you have that weight, the lesser that blood pressure will have somewhere to hide. And if you can truly improve your lifestyle and everything, maybe if you're supposed to be taking 4 pills, they may reduce it to 2, eventually 1. But I encourage you to always seek advice from your doctor, not from anyone else. You can listen to other people, but go and see your doctor. So today we've spoken about high blood pressure. I hope that you take your health seriously so that you can be there for your children. And it's important. I'm doing all of this because I love my viewers. All right, so at my free time, I just pick up my equipment and record this video. So I'll be talking more about health and how to manage your health most part of this year. I'll thank you.